Hi, it's Dr. Elisha Van Dusen with New Hope Chiropractic. Feeling dizzy or off balance are symptoms of a common condition called vertigo. Approximately 40% of Americans report having vertigo at some point in their lives. Although it's not life-threatening, vertigo can be extremely debilitating. When you constantly feel like the room is spinning, living a productive and fulfilling life becomes really, really challenging. Mild cases of vertigo can go away on their own, but you may need treatment for severe conditions. Chiropractic treatment for vertigo can help you avoid traditional medication, physical therapy, or surgery. Now, vertigo is an uncomfortable sensation people experience for a variety of reasons. It can make you feel dizzy and unstable, like you just stepped off a roller coaster or a boat. Vertigo affects people of all ages, but it's most prevalent and dangerous in people who are over 60 years old. There are two main types of vertigo. One is peripheral vertigo. The symptoms here stem from problems in the vestibular system, which consists of structures within the inner ear. Peripheral vertigo is much more common and has less severe implications. And then there's central vertigo. Symptoms here arise from issues with your central nervous system, which consists of your brain and your spinal cord. While less common, central vertigo is often a symptom of more critical conditions. Since many other conditions can cause vertigo, it can be challenging for doctors to find the root cause. Most cases are relatively harmless and easily treatable, while others can be symptoms of a life-threatening illness. Vertigo symptoms are caused by other health conditions that originate in your vestibular or central nervous system. And the source of your vertigo will influence the severity of the symptoms. So that's why it's important to discovering the underlying condition, and that's really the first important step. So here are some of the most common causes of vertigo. You can have small crystals inside your ear. They play a crucial role in regulating your sense of gravity, and that's where benign paroxysmal positional vertigo, or BPPV, comes into play. It's common for these crystals to dislodge and collect in other areas of your ear, causing this condition. People here can experience vertigo, nausea, vomiting, things like that. And it's rarely serious, but typically resolves within a few weeks. Then there's Meniere's disease. Fluid buildup and pressure in the ear contribute to this condition. People with this often have vertigo, tinnitus, which is ringing in the ears, and hearing loss. This disease usually clears up over time, but extreme cases can require surgery. Then there's vestibular neuritis. This is also known as labyrinthitis. This condition stems from a viral infection that creates swelling in the inner ear. The inflammation presses on the nerves that regulate balance, and it often leads to vertigo, headaches, ear pain, vision changes, and hearing loss. And people who have a history of migraines can also get vestibular migraines, and it's caused by problems in the central nervous system, and these don't always cause headaches. Instead, the primary symptom can be vertigo. People also say that they feel nauseous, disoriented, unsteady, and sensitive to sound. Then there's stroke. Vertigo is a warning sign, symptoms of a stroke. And one study, for example, nearly 3.2% of patients over 44 years old who visited the emergency room for vertigo, dizziness, and imbalance were actually diagnosed with having a stroke or mini stroke. Many brain tumors can also cause vertigo because they put pressure on the surrounding tissues, which can cause vertigo, tinnitus, headaches, and nausea. And then also there's multiple sclerosis. This is a common symptom. Vertigo is a common symptom of this. Lesions in your brain can damage the nerve pathways, control balance, leading to dizziness and lightheadedness. So if you have vertigo, typically some of the symptoms are nausea, vomiting, headache, sweating, blurred vision, double vision, hearing loss, tinnitus, slurred speech, weak limbs, difficulty swallowing, and facial paralysis. So in the next video, I'll talk a little bit about some solutions to vertigo and some natural solutions specifically and how chiropractic can help. Check us out at newhopechiropractic.com, and if it's been a while since you've been adjusted, make sure you visit our site and book an appointment. We'll be happy to help you out. With that, have a healthy day.